Welcome back. Yes, you're still tuned into the Tuesday edition of the nation's most favorite breakfast show, Good Morning Namibia. Now, the Namibia network of AIDS service organizations, in collaboration with the joint United Nations program on HIV and AIDS, UNAIDS, undertook a groundbreaking process to develop the requisite standards on national community engagement to improve healthcare delivery as well as outcomes. The official launch of the HIV COVID-19 National Community Engagement Strategy and Plan will take place later today. With more on this launch, I'm joined in studio by the NANASO Executive Director, Mr. Sandy Sharonda, as well as the Advocacy Manager at NANASO, Mr. Zach Makari. Good morning, gentlemen, and welcome to Good Morning Namibia.
Good morning, Good morning. Thank you for having us.
Perhaps let's start with you, Mr. Makari. Talk to us about the importance of community engagement as far as these endeavors are concerned.
Community engagement is going on the ground, touching the actual. Because by engaging community at various levels, various key stakeholders, because you have various stakeholders within communities. Some who are the people living with diseases or problems, some who are advancing or servicing those communities, and linking it to the various public sector facilities. For example, when we are talking about healthcare, the key to success of any service delivery in terms of healthy to people, or to ensure that people are all accessing services, is to say, let us involve the communities, let us engage communities. Because by engaging, the key to it is that you create harmony, you ensure understanding, you ensure involvement, then you also ensure partnership, networking, as well as starting moving together. And you increase even the demand. For example, NANASO, being a key stakeholder within the health fraternity, we are supporting wholeheartedly the call by the national government during the campaign of ensuring vaccination, which was called which was launched on the 4th of August, Friday last week. We are participating, and we are saying to ensure that the time has come to have a strategy, to have a plan, to have a tool whereby we ensure that we harmonize and we ensure that all communities are involved at various levels, be it religious groupings, be it traditional groupings, be it NGOs, be it CBSO, small organizations, etc., etc. And that's why we are saying the importance of this strategy is to ensure that engagement is the key.
Very well. Mr. Sharonda, Mr. Makari has in great detail shared with us what exactly the significance is of community engagement. I would like us to take that a bit further. To what extent does community engagement play a role in eradicating, eliminating structural and or legal barriers that may continue to persist?
Thank you so much. I want to say that just like Mr. Makari has outlined and ably explained, community engagement is the blueprint that will help us to involve different constituencies, populations that are inadequately served and that services are not reaching to. Community engagement allows you to help to be able to increase the uptake of service. It's very, very important that one make mention of the distinction between community engagement and consultation. I think most of the time we are falling into the trap of consulting. Consulting is not enough. You need to engage. And there is a distinction there.
Very briefly, what is that distinction?
The distinction is to consult, you can consult without measuring and without results. The result is actually to satisfy yourself. It's about ticking the box. But engagement, you make sure that you leave the community engaged so that they can actually take ownership of their own destiny.
In other words, engagement leads to empowerment.
Engagement is empowerment. Engagement gives the capacity to those communities to be able to respond.
Thank you, sir. Thank you, sir. Mr. Makari, as far as the plan is concerned that will be launched today, very briefly talk to us about what it will entail.
The plan entails ways and means on how to add value to what we have currently. For example, when we are talking about the country is having various strategies, various plans within the country. at various levels, various ministries and so on. Now, we as civil society, we are saying, through this plan, we will be able to say, from ground level up to mid, up to middle, up to the upper, how do we, who is where, who is doing what, and who should link with who, whereby people will share that, what is our comparative advantage, how do we minimize duplication, and who is the best to do X, Y, Z, and how do we influence national policy documents. For example, whether you talk about NDP 6 to come, or whether you talk about strategic plan with the Ministry of Health on various issues, whether you talk about the Sustainable Development Goals, how do we ensure that as civil society, where are we, and how will we beef up?
Thank you.
And how can we add value? So because of that, the launch is the key document for advocacy and networking, and ensure that success for a healthy nation, for productivity, and the best for all.
Thank you so much. Mr. Ronda, I wish we had more time, but we certainly do not want to preempt the launch at 10 o'clock this morning. Your brief concluding remarks, please.
I just want to say that this document, this strategy takes full support or leans mostly on the Global AIDS strategy. The Global AIDS strategy makes these commitments under what they call the high-level 2025 targets. That by 2025, 30% of testing and treatment services will be delivered by a community-led organization. By 2025, 80% of service delivered for HIV prevention programs for key population and women will be delivered by community and women-led organization. By the same 2025, 60% of the programs will be supporting the achievement of social or societal enablers to be delivered by community-led organizations. So you can see the threat of communities everywhere. That is where we are going to, and that's why we have developed this strategy to take us to that.
Thank you, sir.
Goal.
Thank you. Your final thoughts, please, sir?
My final say is to say, we have been in COVID era. We are still having into post-COVID, a call by the nation to say, come and be vaccinated, and also other services. It's a national call. It's a service. It's a chance now. It's like God saying, I'm knocking at your door, open. The country is saying, the opportunity is now. Fellow Namibians, all of us, key stakeholders, let us assist one another so that all of us get vaccinated at various levels, at various needs, and eventually, the more healthier we become, we can transform our country into a developed country for the betterment of all, and peace and harmony will always flourish.
Thank you very much, gentlemen. May the launch today be a resounding success.
Thank you so much for having us.
There you have it. Let's not forget the devastation brought about by COVID-19, and that no one is safe until everyone is safe. There is an opportunity still, and there continues to be, to get vaccinated against COVID-19. Later today, the HIV COVID-19 National Community Engagement Strategy will be launched. We will be right back after a brief break.